What causes ear ringing? Ear ringing is like a mysterious sound echoing in the depths of your ear canal, but fear not. We're here to unravel its secrets and shed light on why it happens and how to deal with it. So imagine you're going about your day, maybe enjoying a peaceful moment or working hard, when suddenly you notice this persistent ringing in your ear. It's not just any ordinary sound. It's like a buzzing, hissing, or even a roaring noise that seems to come from nowhere. What gives? Well, let's start with the basics. Ear ringing, or what we commonly refer to as tinnitus, can occur for various reasons. Sometimes it's a standalone issue, and other times it's a symptom of an underlying health problem. The thing is, our ears are complex structures, and any disruption in their delicate balance can lead to this mysterious ringing. Now, tinnitus isn't just about hearing ringing. It can manifest in different ways for different people. Some might hear buzzing or humming, while others experience a high-pitched whistling or a low rumbling noise. It can be constant or come and go intermittently, making it quite the enigma to deal with. One of the main culprits behind ear ringing is something called allergies. Yep, those pesky seasonal allergies or a nasty sinus infection can wreak havoc on your ears. When your nasal passages get all stuffed up with mucus, it can block the tiny tubes that connect your ears to the back of your nose. This blockage messes with the pressure in your ears and can lead to that annoying ringing sensation. But wait, there's more. Certain medications can also be to blame. You know how some drugs come with a laundry list of side effects? Well, ringing in your ears might just be one of them. Drugs like aspirin, antibiotics, or antidepressants can mess with your inner ear and cause that dreaded ringing noise. And let's not forget about good old age-related hearing loss. As we get older, our hearing naturally starts to decline. It's just a part of life. But sometimes, this hearing loss can manifest as tinnitus, especially if it's accompanied by other factors like exposure to loud noises over the years or genetic predispositions. Ah yes, loud noises. Ever been around loud noises and felt like your ears were still ringing hours afterward? That's because exposure to loud noises can damage the delicate cells in your inner ear. It's like a mini explosion happening inside your ear canal, and unfortunately, it can leave a lasting impression in the form of tinnitus. Believe it or not, even something as harmless as earwax can cause your ears to ring. When you've got a buildup of earwax or it's impacted in your ear canal, it can throw off the natural balance and mess with how your brain processes sound. Suddenly, that harmless earwax becomes the villain behind the ringing in your ear. Now here's where things get a bit serious. Ear ringing can also be a sign of underlying health conditions. Things like head injuries, high blood pressure, or even tumors can wreak havoc on your auditory system and cause that persistent ringing. So it's essential not to ignore any other symptoms you might be experiencing along with the ringing. But fear not, dear reader, for there are ways to tame the beast that is ear ringing. It all starts with understanding what's causing it in the first place. Once you've identified the culprit, you can take steps to address it and hopefully find some relief. For some people, using hearing aids can help. These nifty devices can amplify external sounds and make the ringing in your ear less noticeable. In more severe cases, a cochlear implant might be necessary. It's a tiny device that's surgically implanted inside your ear and helps send external sounds directly to your auditory nerve. But what if you're not keen on the idea of sticking something inside your ear? Fear not, for there are other options. Sound generators, for example, can be a game changer. These devices produce soothing sounds like waterfalls or white noise that can help mask the ringing and make it less bothersome. Then there's tinnitus retraining therapy, or TRT, a fancy name for a process that helps your brain get used to the sound of tinnitus. It involves listening to noise similar to your tinnitus for extended periods, sort of like exposure therapy for your ears. It takes time and patience, but for many people, it can make a world of difference. And let's not forget about good old-fashioned counseling. Cognitive behavioral therapy, or CBT, can help you develop coping strategies and relaxation techniques to manage the psychological toll that tinnitus can take. Sometimes just having someone to talk to about your struggles can make all the difference. Of course, treating the underlying cause, if there is one, is always a priority. Whether it's switching medications, using protective headphones in noisy environments, or addressing an underlying health condition, tackling the root cause of the problem is key to finding long-term relief. Now, I know what you're thinking. When should I see a doctor about this? Well, if your ear keeps ringing for more than a week, or if you're experiencing other symptoms like dizziness or nausea, it's time to seek medical attention. Your doctor can help you figure out what's going on and come up with a plan to address it. So, while ear ringing might be a nuisance, it's not something you have to suffer through in silence. With the right treatment and support, you can tame the beast and reclaim your peace and quiet. Just remember to take care of yourself and listen to what your body's trying to tell you. Thank you for watching. Don't forget to like, comment, and subscribe. Watch more videos by clicking on this video right over here.